All right, hello everybody and welcome. Thank you so much for joining us for today's call. We're so happy that you are here. This is the ESRD Learning and Action Network series. This is the very first Bloodstream Infection Quality Improvement activity for 2020. This is Stephanie Hull and I will be your host for today. We want to go over some housekeeping reminders. Many of you who have been on the calls previously and we had used ReadyTalk previously, and we have migrated toward a new platform called Global Meet. So I want to take a little bit of time before we get started on some things that are going to look a little different for participants. I also want to stress that you need to stay on the call toward the end, and I want to go over the CEU process because it is different from last year. So it's very important, do not hang up early today. Stay on the line so I can go over those directions with you. We are streaming this audio for this event via the internet. There is no telephone lines required. And also troubleshooting echo is caused by multiple connections to a single event. So if you're hearing any echoing, close all but one of your browsers. This event is being recorded and all the material will be available from your network representative in 10 business days. Phone lines, we have limited dial-in lines that are available, so if you absolutely cannot get on and need a phone line, please request that via the Ask a Question box located in your kind of mid left-hand section of your screen. Some more troubleshooting for audio. If your audio from your computer speakers are breaking up or the audio suddenly stops, click your refresh button that's located in the toolbar in the left upper hand of your screen, or you can also hit the F5 key that's on the top row of your keyboard. When submitting questions, again, we don't have really a chat box anymore. It's now called Ask a Question, and that should also be located on the left-hand side of your screen. We do want to hear from you. We do want questions to come in for the presenters at the end of this session, so please utilize that Ask a Question box on your screen. So reasons for the participation in today's LAN. We're going to learn about the function and resources of the National Patient and Family Engagement Affinity Group. Ways to spread the best practices from the LAN. Number one, you're going to listen and share your approaches or experiences via the chat box or the Ask a Question box. We're going to identify how this shared information could be used at your facility and ask that you apply at least one idea from today's LAN at your facility, something that you can take away from this live event today, this LAN, and implement in your facility. And what can we commit to do today? Again, identify and implement one action item from this meeting that can directly decrease the number of BSIs in your facility. Before we get into the presentation, I do want to take a moment and share with you the pre-work questions that many of you did take, and I thank you for everybody who took the few minutes to do them. We had two questions, and the first one was, are you aware of the role of the ESRD NCC, National Patient and Family Engagement Learning and Action Network? So 319 people responded, and 62% said yes, they did know the role of the ESRD NCC and NPFE-LAN. And about 38% said no, they did not. The second question, have you ever used a resource by the ESRD NCC NPFE-LAN? Again, out of the 318 that answered that question, 36% said yes, they did. And about 34% said no, they had not used any resources. So we're going to introduce our speakers for the day. We have three. And the first one is Ms. Pearson. Ms. Pearson is She is a BSI Affinity Group subject matter. expert. She was involved with the development and testing of the Test Your Hand Hygiene Knowledge interactive tutorial. Ms. Pearson has volunteered with the National Patient and Family Engagement for the last year, and she also volunteers for the ESRD Network 14 of Texas. The next speaker, we have Jerome Bailey. He is the Associate Director of Patient and Family Engagement for the ESRD Ncc. Mr. Bailey has been instrumental in forging new pathways for patients to remain connected in the virtual LAN and providing multiple avenues for patients to share their perspectives. And then lastly, we have Kim Buettner. She is also Associate Director of the Patient and Family Engagement for the ESRD Ncc. Ms. Buettner leads patient and family engagement efforts by collaborating with ESRD networks and community stakeholders through person-centered relationships with renal patients and their family members. So I'm going to turn this over to Jerome.
Thank you, Stephanie. The National Patient and Family Engagement Learning and Action Network team, thanks you for allowing us to kick off the QIA LAN year of calls to talk about promoting bloodstream infection prevention and with patient-centered resources, and talking to you about the role of the NPFE-LAN. Next slide. So here's a look at what we will do on today's call. We'll discuss the definition of a LAN. We'll explain how affinity groups support the LAN. We'll share the vision and goals for the LAN and affinity groups. We'll review the BSI Affinity Group developed resources, and we'll hear from a BSI Affinity Group patient subject matter expert. Next slide, please. For those of you on the WebEx, this is the NPFE-LAN team. I'm Jerome Bailey, and Kim Buettner is my partner. Our CMS NPFE-LAN subject matter expert is Jaquincia Polk. With CMS direction and support, Kim and I work with patients and caregivers from the 18 ESRD networks to develop resources to enhance the quality of care of patients across the country. Next slide. Stephanie, you can kind of go through all the slides of the SMEs. Here are some of the NPFE-LAN SMEs that we work with. They are a very diverse group of individuals. They come from different social, economical, and educational backgrounds. The SMEs serve 2-year terms and then are able to transition to become a legacy SME. We transition SMEs off the LAN to the new patient for new patients and new ideas to come into our work. Next slide, please. And I will let Kim.
Thank you, Jerome. The NPFE-LAN is a group of patients, caregivers, and healthcare professionals who work together to make healthcare better for kidney patients. There are more than 90 SMEs nominated to be part of the NPFE-LAN. They represent the 18 ESRD networks, which cover all 50 states and U.S. territories, such as the U.S. Virgin Islands, Puerto Rico, and Guam. All treatment modalities are part of the LAN. So what is the goal of the LAN? LANs value the knowledge that members bring to the group and use this information and ideas shared by members to make improvements quickly through many small changes. These small, quick improvements can add up to make big differences in the lives of kidney patients. The patients and family members that are a part of the NPFE-LAN develop resources to help support the network quality improvement activities. The NPFE-LAN shares best practices and supports the spread and resources to ESRD networks, quality facilities, dialysis facilities, transplant centers, and renal community advocacy groups. Next slide, please. As part of the work of the LAN, we work to identify QIA resources, adapt resources for patient and caregiver use, share resources with ESRD networks and community partners, request networks to share the resources with their facilities, ask SMEs to share resources at their facilities, discover partnerships with kidney community stakeholders, and spread the resources through collaboration, social media, and website posting. Next slide. The CMS ESRD Network Program has 4 broad goals. They are to empower patients to make decisions about their health care, usher in a new era of state flexibility and local leadership, support innovative approaches to improve quality, accessibility, and affordability, and improve the CMS customer experience. All the ESRD networks work on QIAs that address these broad goals. All the QIAs need to incorporate the patient and family members' ideas. We count on patients and family members to share their ideas within the LAN. Next slide. Within the LAN, there are smaller groups called affinity groups. These groups work collaboratively to promote communication, choice, and respect. They build on the group's individual and collective strengths. They encourage patient and caregiver SMEs to share their valuable perspectives and ideas to improve the quality of care for all ESRD patients. And they promote an all-teach and all-learn environment to develop resources and materials that are ultimately put into action and shared beyond the LAN itself. Next slide. This year, the NPFE-LAN, in conjunction with the ESRD networks, is supporting 3 areas of focus for CMS: reducing bloodstream infections, increasing the number of dialysis patients dialyzing at home, and increasing the number of patients getting transplants. There is also a patient-selected topic affinity group, and in 2019, this affinity group chose to focus on helping patients and caregivers improve their emotional well-being. We will be working with the patient-selected topic affinity group this year to determine what their focus is going to be.
So, next slide.
I think it's our first polling question.
Okay.
So let me just bear with me 1 minute and we will send this out to the audience. And we'll give everybody, a little bit of time to answer. What resources do you use to teach your patients about BSIs? Okay, I think we are getting quite a few responses, and I think I will close it out here in 3, 2, and 1. And I'm going to send it out there. Okay. And share everybody the results here. So what resources do you use to teach your patients about education, about BSI? Almost 22% said the ESRD network supplied education. 4% said use the NCC clean hand count resources. Almost 42% organization issued education. 30% said CDC provided resources, and about 3% said other. So, Jerome or Kim, I'll hand it back over to you.
Thank you, Stephanie. So for this call, we are focusing on the work of the BSI Affinity Group. The BSI Affinity Group identified the best resources to educate patients and healthcare professionals about the importance of clean hands. The resources selected were originally developed by the CDC, but modified by a previous BSI Affinity Group. They were modified to look more like patients in a dialysis center. They include a Clean Hands Count poster, a Clean Hands Count flyer, a Clean Hands Count brochure. They developed 2 additional resources, the Clean Hands Count badge, which a patient or staff member can wear in the dialysis facility. On one side of the badge, it says Clean Hands Count. On the other side of it says, thank you for washing your hands. It's made with a hospital-grade laminate, so it can be easily cleaned. The SMEs were eager to share and spread these resources within their dialysis units, network packs, support groups, and at national patient and professional meetings. Several of the SMEs work within their ESRD networks or their dialysis centers to host Clean Hand Count lobby days. And all of these resources are available in Spanish. Next slide, please. So there is also a Test Your Hand Hygiene Knowledge interactive tutorial. In the tutorial, there are 3 scenarios in which the user must decide if the dialysis facility staff member is using hand hygiene best practices. The interactive learning module was originally developed by ESRD Network 7 and 17. When we first showed the SMEs the video or the interactive module, they told us that it was informative, especially on when to use soap as opposed to sanitizer. But they also said that the video needs to incorporate what a patient's responsibility is towards washing hands as well. They said that it should incorporate how failing to follow proper hand washing techniques can result in BSIs, along with listing some common symptoms of BSIs. And one of the SMEs told us that they like that it shows the patients how to approach and ask staff when they have missed the step of washing their hands, because many patients are afraid to speak up because they think they will not be treated as well if they do. So the tool was updated with several of their recommendations. The goal of the interactive tutorial is to improve infection prevention practices, engage patients and staff in infection prevention activities such as hand washing or hand sanitizers when appropriate, reinforce understanding of potential infection prevention sources, and demonstrate proper hand washing techniques. I would now like to introduce Sardeliah Pearson. She goes by the name Dee. Oh, before I introduce Dee, we have another poll, I think.
Okay.
So hang on, Brett, 1 minute. We've got one more polling here to do before we get in with Ms. Pearson. So let me go ahead and get that out to you, to everybody. So I'm sending that out now. So the second polling question is, what is the best method to get education about BSIs to your patients? So I'll send that out and give everybody just a little bit of time to answer these. And we're getting in quite a few responses already, so we'll just give a little bit of time and I will close that out. I'll close that out in 3, 2, and 1. I'll send that out to everybody to share. And let's see, what is the best method to get education about BSIs to your patients? Almost 40% said the handouts are very effective. 15% said bulletin boards. 28.5% said individual education for staff. And lobby days was another one. It's almost 22%. So very good. So I'm going to close that out and we'll get back now to Jerome.
All right. So now I'd like to introduce you to Sardeliah Pearson. She goes by the name Dee. Dee is from Wichita Falls, Texas, which is ESRD Network 14. But before I hand the call over to Dee, I'd like to share some good news. Dee received a kidney transplant over the holidays, so we are very happy for her. She was very instrumental in creating these resources and sharing them with her community, and now she is going through the process of recovering from the transplant that she received about 2 weeks ago. So welcome to the call, Dee.
Thank you, Jerome. And yes, it was December 23rd that I received the transplant. I'm doing pretty good now, so real excited. This past year, 2019, I did do 4 lobby days that were based on BSI and the bloodstream infection. So pretty much what I did, all of the flyers and brochures that were sent to me, I made a big poster board and set it up on a table explaining exactly what a BSI was and the number one way to prevent it, which is by us washing our hands. And I made a big board that said clean hands count. With the informative module on the clean hands knowledge, I set my laptop up in the lobby, and then when patients came in, if they wanted, I let them go on my laptop and do the 3 scenarios, and they can answer the questions to whereas if the staff needed to wash their hands with soap and water or to just use hand sanitizer. During the lunch break of the staff, they allowed me back into the, I was able to go into the back, or into the break room with my laptop, and I used it as an in-service. So every person that worked the floor, as well as the people that were in the offices, such as the social worker, the dietitian, the computer guys, I had them all go through and do the module on the laptop. And then once they did it, I had candy, and then I would give out to them. And those were the first 2 days of my lobby day that I did that. The 3rd and 4th day, after a couple of months, I did another 2 lobby days. And the staff who I knew had done the module, I asked them to kind of go over when they're supposed to wash their hands or just to hand sanitize. And the staff members that answered correctly, I gave them the Clean Hands Count badge. So they would wear the badge. And so if they were wearing the badge, then it meant that they were compliant and understood the CDC protocol to the hand washing. I also wanted to just really encourage the patients and to make sure that they understood when someone was supposed to wash their hands and that it is mandatory for when one staff member goes from one machine, even if they're charting, and they go over to another, that they need to hand sanitize and change their, or they need to take their gloves off, sanitize, and put on new gloves. So it was really important for me that everyone in the clinic understood the CDC protocol, and that I wanted the patients to know so that they would feel comfortable that if they did see someone, because I know that people can get in a little bit of a rush or a hurry and we can forget. But if they did see someone forget, to say, hey, could you please wash your hands, or could you please change your gloves, could you please sanitize? Because I know we don't see it, but it's really important. And bloodstream infection is something that is very easy for a patient to get. And so that's what I did for the 4 lobby days. And then encourage staff, for anyone new that wasn't there for the lobby day, to go through and explain to them about the hand washing. And I think that's about it. Hello?
Okay, well, thank you, Dee. And I just encourage everybody, if they have questions for Jerome, Kim, or Dee, to please submit them in the Q&A section. And I have to say, there were a couple emails that came in, or not really questions, but a lot of congratulations for you, Dee, for your transplant. So quite a few people saying congratulations. So that was very nice. Yeah.
Thank you.
So there's a couple questions that I will go ahead and get started. That for the audience, it said, Karen asked, will we get the links to all those handouts that I think Jerome and Kim went over? And yes, I can definitely include those when we send out the material to the networks. We will be sending out this PowerPoint presentation, and of course the recording will be available, but we will also send out the links to any of those handouts, the clean hand counts and all of that that was mentioned. Another question, and maybe Jerome, you can answer this. Where do you find the Test Your Knowledge online?
So the Test Your Knowledge hand hygiene tutorial is on the Esrd Ncc website in the patient section, the patient resources section under the BSI drop-down. If possible, Stephanie, I can send you the link for that, and as you're sending out the links to the resources, you'll find the tutorial.
That would be great. That would be great. I will do that. So if you can do that, I'll get them all together if they'll be in one place. Okay, thank you. Another question, and it could be for anybody. What did staff do to be considered participants in patient engagement in order to get the badges?
Dee, you want to answer that? Since you
yes.
hosted the lobby day?
Yes. So when I did the first 2 days, I did like an in-service where the staff could go through and do the hand knowledge module. And then after they did that, when I did my 3rd and 4th days, I went to the staff and I asked them questions like, say you're charting and you're going to go to the next machine, what are you supposed to do? And if they told me, I remove my gloves, hand sanitize, and then put on new gloves, then they could get the Clean Hands Count badge. Or I asked, let's say you're working with a patient and you get some sort of visible material, whether it be blood or fluid on your gloves, what are you supposed to do? And if they answered, I remove the gloves, I go to the sink, I wash my hands with soap and water, and then I go back and get new gloves before I go to the next patient, then they would get a badge like that. So as long as they knew the protocol, then they could get the badge. If they didn't know it, then they didn't get the badge.
Great, thank you. Making them work for that. So may I ask you, Dee, did you have to learn the policies then and the protocols at the facility?
Yes, I did. I did learn it. Just so if I didn't know it, then I couldn't expect anybody else to know it. So,
right.
And so that module, that really did help because there were some things that I didn't know. Like I didn't know if you had blood or anything on your gloves that you're supposed to go and wash your hands with soap and water. And so that was something that I noticed that I had seen, and I never saw anyone go and wash their hands with soap and water. So that was something that was good for me to learn. And then even that staff, they're supposed to wear gloves even if they're just charting. And I've seen a lot of people that don't wear gloves even when they're charting. And there's a lot of things that we can't see, on there, or something that might have splattered and dried up or anything like that. So I did take the time to go through and learn that protocol.
Perfect, thank you. Okay, we have another question here, again, for any of the panelists. Were the patients at the clinic willing to ask staff to change gloves and wash hands? And then how did the staff respond to it? Sounds like a question for Dee. Mm-hmm.
Yes, there have been some instances where patients, they'd say, hey, can you wash your hands? Can you get your gloves? Change your gloves? And I have to say that I'm very blessed that I have a really good clinic. And and even with me when I became a patient advocate, and then now being part of the NCC LAN, the staff has all really worked with me and been patient, and they do well with correction. Well, that sounds harsh, correction, but they do well with if someone says something, if they haven't done it, then about 9 times out of 10, they go and do it. I've never heard of, or I haven't heard any resistance from the staff towards the patients. And so they've always been really nice, and oh, I'm sorry, I forgot, things like that. But that's in my clinic. Yes.
But Stephanie, we have heard in our LAN meetings, affinity group meetings, patients getting a little pushback from staff, but they say that wearing the badges really helps alert staff to the need to keep their hands clean.
Perfect. Great. Well, there's another question, and probably for Ms. Kim, this might be right up for you, because the question comes from Melinda Watts. She wants to know, is there a charge for the clean hand count resources?
For the flyers and the posters and the brochures, no, they are available through the NCC website. There's links on there. You can just print those, and there's no charge. However, if you are interested in the Clean Hands Count badge, all the ordering information is available on the ESRD NCC website. That's provided from another vendor, and that information, the vendor contact information, is on the website, and you can contact that vendor directly, and they will let you know what the fee is for those badges. So when Stephanie, when you send out the information, we can include those links as well.
Okay. Yeah, and I'm sure those costs are dependent on how many you order. Correct.
Correct.
Kim, probably.
There's a 50-piece minimum for the badges, and obviously the more you order, the more the cheaper it is per piece. But the printer will work with each facility or network individually to meet your needs.
Perfect. Thank you. Another question, and maybe for Dee, because I think this probably is what she did. How do you organize a lobby day? And is there a sign-up list for lobby day if my facility is interested in organizing one in the future?
Okay. So what I did was I would, in my mind, would go through my calendar of when I would be either off from work or could take off work, and then I would go and I would speak with one of either my clinic manager or one of the social workers, and I would ask them, hey, I'm wanting to do a lobby day on these 2 days, and just to make sure that they don't have anything already going on in the clinic. And if they don't, then what they'll do is write it down on the calendar, and then either the night before or the day before we can set up a table, and then I would come in a little early and I would decorate the table and decorate the lobby. And another thing is that I found that it works a lot better if someone else is with you. So what would some of the staff, like the people that work in the offices, they would take shifts with me. So for the first couple hours of the first shift, it would be one of the dietitians, and then it would be like one of the social workers would come and sit with me. And we would speak with the patients, explain what the lobby day was about, hand out the flyers, like that. So if you did want to do a lobby day, I would just recommend talking to someone in your clinic and just making sure whatever day you're wanting that it's not going to run into like the doctor coming and seeing all of the patients. Because I did do that once, and it was like heavy traffic. Or make sure that your home dialysis people aren't coming in for lab work that day, because you have so many people, constantly in and out. So that was how I did it.
All right. Okay, great. Thank you. A question comes in from Katina, and it asks, are the SMEs required to complete documentation in the computer? I think, Dee, this is for you. As a engaging, did you have to do any documentation in the computer? And I'm going to guess that it's the computer at the facilities?
You mean the people who did the module? I'm not sure I understand.
Are the subject matter experts required to complete documentation? I think regarding you, did you do anything in the computer? To joining the NCC LAN? I'm sorry. Well, maybe Katina, maybe you can send in exactly what you were asking on that, clarify that question for us.
Okay, sorry about that.
We'll move on. Let me see. Here is, does D have a structured format that could be replicated by any patient who might be interested in hosting a lobby day?
I don't think I have a structured format, but I bet I could make one. I just kind of went along with it, and whatever I had in my mind is what I made. It really helped when I got the posters and the flyers to hand out, and then pretty much the only thing that I really had to work on was when I made the big board to put on the table, and when I decorated the poster boards about clean hands count, which I believe Jerome put some pictures for other people to see. And so those boards, I just kind of made that up as I went. And but I will say that one thing that I do always do for every lobby day is I always have dialysis and diabetic-friendly candy. So if someone, when the patient comes to the table and, they get the reading material, they listen to me for a few minutes explaining, what the lobby day is for, then I'll give candy out. And so that's a little bit of an incentive too. People tend to listen more when you're going to feed them. So that is one thing. That's one thing that I do.
Right. A lot of questions for you, Dee. So you're the main questions are going to. So it asks, for lobby days, is it mandatory that we have the patients sign in? Did you track your patients who attended?
Yes. And so what we would do, the social worker or dietitian would print out a little paper, and the patient can put their name on there. And that there is just to show that the education and letting us know everyone that we're able to reach, making sure that we're talking to, if not all, but the majority of the patients. So they can print out like a paper, have the patient sign, and then that just shows that they receive that education. As far as it being mandatory, I'm not sure if it's mandatory, but that is something that we do. Okay,
great, thank you. Another question for you, Dee. How did Dee become a subject matter expert?
Well, I was part of the PAC for 2 years, and then last year, when we had our face-to-face meeting, a list went around, and I had heard a lot about the NCC LAN, and so I signed my name on there, and then I got a phone call from, I believe, Jerome, saying that I've been picked to be part of the BSI. So it was kind of simple like that.
So,
thank you.
Stephanie, a little bit more about that. All the SMEs are nominated by their ESRD networks. And so if a patient is interested in becoming a part of the NPFE-LAN, they would have to talk to their ESRD network patient services staff to let them know that they're interested in becoming a member of the LAN.
And if I can jump into, we've received a couple of questions just about the time commitment and we let the SMEs know they meet for a meeting a month for about an hour and a half. That's the affinity group that they are serving on. And then just as Dee has demonstrated on this call, they then share the resources that are created in their affinity group, either in their facility or their transplant center or just in their community. A lot of our SMEs are very active with their support groups. So then they will share the work of the NPFE-LAN and the work that they've been doing on their affinity groups within their community. So that's how the concept of spreading the work of the NPFE-LAN happens, and so that's what the SMEs are able to do. So what Dee has demonstrated is what she's been able to do in her community by showing the difference that her affinity group made with these resources, and then she took it to her community.
Perfect. Thank you. And actually, that was a question I was going to ask. Somebody asked, how much time does a patient SME, how much is that required to do all those roles? So, Dee, can you kind of, in general, kind of average maybe on a monthly basis how much time you are committed to doing some of this work?
Yeah, sure. Like I said, we do have a meeting every month where we go over different topics and focuses, even where we update like the modules, and so that's that time. And then whatever time it takes for me to make the boards and then to do the lobby days. So I have kind of a big clinic, so I stay for all 3 shifts. So it's a good few hours that I'm there at the clinic. But honestly, I really can't tell you how much time exactly. It's going to be a little bit of time. It's a little bit of extra time to work in there. And if you want to do a whole lot, you can, or, do as little, however you decide, to reach out to your community in your clinic. It kind of just depends on you. I like to stay busy, so I enjoyed it and things. I mean, it's not like your whole entire day, but, I mean, you can make time for it. It really is doable.
Great. Thank you, Dee. A question came in here from Robert, and Robert wants to know, did the staff that was awarded the badges continue wearing the badges even after the lobby day, and for how long?
Yes. They did continue to wear the badges, and every time whenever I would come in for treatment, they would stick the badge out like, hey, I'm wearing my badge. And so I don't know what it is, but having that badge, it just made me seem a little bit more proud, or, like I'm doing something good, I'm doing something right. Or, and even with new people that came into work, hey, where'd you get that badge? Or, what do I need to do to get that badge? So, yeah, they still do wear it.
Great, I like that. It really sounds like it stirred up a lot of good conversation and stuff. Perfect. All right, we have, let's see, we've got time for a few more. A question for Dee. Dee, what is your plan for the future since getting a transplant?
So right now I am still on the road to recovery, and my mom asked me this the other day what I was going to do when I got home, and I just feel like I just have so much time now. I will go back to work for a little bit, but my main plan was to go and work in my clinic and to go back to school and get my nursing. And so I have the time to do that now. And so right now that's what my plan is.
Perfect. Awesome. That sounds awesome. Got another kind of a question, I think reconfirming, Dee. Did you provide a badge to patients who participated in the lobby days education?
Yes, I have. There are 3 other, there's 3 other facility patient representatives, and I did give those 3 a badge. And there were a couple of other patients who were asking about it. And these were the two other people. They wanted to wear the badge because they wanted to keep staff accountable. They wanted staff to know that they knew what they were supposed to do. So that was kind of why they wanted it. I think after so long I ran out of badges because I even handed some out at a meeting for the PAC group we had in Dallas where the professional people were there, and I handed out badges to them. So I had a lot of badges, and
right.
so I handed out to them and to my PAC team as well. Yes.
Right. I just got a question here, and I just, for everybody really, and actually I'll just answer it. It just says, could you send the link to the Clean Hands Lobby Day material? So yes, those will be sent out again when the NCC sends out all the information to the networks. That will be included. So just for everybody, these will be included, the links. And let me see, we got one more. Well, here's one that just kind of a question for you, Dee. And again, if you feel comfortable, it just says, thank you so much for doing this. Are we able to contact Ms. Pearson to help with scheduled lobby days? So I don't know if that means just for advice but please.
So, Stephanie, if the person who asked that question wants to contact Kim and I, we'd be happy to talk them through the process of setting up a lobby day.
Okay, that would probably be better. And that's person who asked, that's a T. So T, you need to contact the NCC info email address, and you would be able to get a hold of Jerome and Kim and help. They would be glad to assist you with setting up some lobby days with a SME. So, and well, this is kind of not to do with BSI, but again, Dee, for you, how long did you wait for a transplant?
Okay, so in February, it would have been 10 years that I'd done dialysis, but at the beginning of 2019, I decided, you know what, I didn't want my entire 30s to just be me being on dialysis. So I decided to go ahead and, sign up to try out for transplant. And I actually got on the list October 21st. I was put on the transplant list. So from October 21st until December 22nd, I received 4 phone calls for a transplant. 3 of them, they weren't good, but that 4th one is the one that was good, and then I was able to get it. So it was maybe 2 months that I was on the list before I got the transplant.
Great.
Yeah.
Thank you for sharing.
No problem.
I think we have quite one more, and I think then we're getting kind of near the hour, so I do want to keep us on time. The question is, in the lobby days, do you have a program for patient education to always wash their access before sitting in the dialysis chair?
And yes, we do. We do have that. And then we also have, when you walk into the clinic at the scale, right next to the scale is a hand washing, and then there's laminated boards that are around that sink that says to wash your hands and your access before you go and sit down. So that is something that is immensely encouraged for patients to do, to wash their hands and their access.
That's perfect.
Yes,
thank you so much. I think I'm going to go ahead and kind of wrap up because we have a couple of things to go over with today. I just want to thank, first of all, especially Dee, just having a transplant. That's great news, and thank you for still participating in our very first BSI LAN call for 2020. Thank you, Jerome and Kim, for taking time out of their busy schedule, too, as well as everybody for coming on this call today. I know just everybody's getting back to work after the holidays, and it's tough. I do want to kind of wrap it up, and please stay on the line because in closing, I want to go over the new process for getting CEUs going forward. Again, with the new platform that the NCC is using this year, it's a little different, and hopefully today certainly was seamless on your end. We're getting a little bit used to it, so excuse us if we had a couple little hiccups, but I think overall it went well. I do want to ask that if your facility has a promising practice or sustainable practice relating to reducing BSIs, we want to hear from you. We are just now, NCC, getting started our planning for the upcoming BSI LANs for 2020. So if you have some success stories from last year that worked well, some best practices, please let us know, and we will get in contact with you and discuss a potential, you're presenting at a potential upcoming LAN. You can also follow us on social media for any updates. We're on Facebook, we're on Twitter, and of course YouTube. You can always follow us. Again, for all the attendees, these things, all the materials for the LAN, as well as the recorded event, will be available in 10 business days, and they will also be posted on our website. So the evaluation process, if you attended last year's any of the LANs, usually what would happen is at the end of this event, when I close out the event, you would get a pop-up for the SurveyMonkey, and then you would take you to the CEU process. A little different this year. Right now, if you want, you can click on that link that is shown on your screen there for the SurveyMonkey, the very first link, and it will take you then to the survey. You can complete it, submit it, and then it will take you to the CEU links. Also, the second way to get your CEUs is everybody who has registered and that attended will be getting an email from the NCC that has the link also to the survey and the CEUs. So there's two ways to get them. And again, it will be the email address that you used during registration. So if you used your home email, something, Susie Smith at Gmail, that's where it's going to be coming. It will not come to your work email unless that's the one you used. So very important. So there's two ways to get the evaluation this year. You can click on right now. I'm going to keep this up for just the next couple minutes, or check your email, and in about 4:15 Eastern Standard Time, you should be getting an email that will allow you also to do the survey and get your CEUs. So I believe that really concludes our LAN for today. Got done a little bit early, but actually I wanted to make sure we had time to go over that. Again, thank everybody for attending. Thank you, Jerome, Kim, Dee, for presenting today. Was very good. It was a good way, I think, to kick off this new year, getting the patient involved. You're going to hear more and more about that throughout the year through CMS and different other projects that are going on with your networks. It's very important to include our patients and patient caregivers in any of our processes that we do. Any of our quality improvement, any kind of patient engagement is always important. So we would just like to go ahead and thank everybody, and we'll end the conference, and thank you so much for attending. Our next one will be in March. Everybody have a good rest of the day, and thank you for attending.